Hello everyone, my name is Jeanette Ponce. This is my proposal research presentation for Kin Science 21 with Dr. Andy Herrick. My title is Anaerobic versus Aerobic Training Effects on the Menstrual Cycle in Collegiate Female Athletes. So I know not everybody is very aware or knows about the menstrual cycle, especially not our male coaches or males in general. But the menstrual cycle is 25 to 28 days long. So give the girls a break. According to Timon, the menstrual cycle is divided into 3 phases. We have follicular, ovulatory, and luteal. According to Lima Costa, each phase is indicated by several days. The follicular phase is between the 3rd and 5th day, the ovulatory phase is between the 9th and 15th day, and the luteal phase is between the 21st and 28th day. And of course, it can vary. It can be very different for every female. Some might have their menstrual cycle go longer, a little bit longer. Some might not have it at all. So those are important things to be aware of, or to understand at least a little bit. I was able to gather enough information to understand the effects aerobic and anaerobic exercises can have on the menstrual cycle, especially since we have a lot of female athletes now with Title IX and just more females being interested in athletics. However, previous studies did indicate that there are certain changes that can affect the cycle, which can be due to high intensity training, body weight, fat ratio, hormonal secreting values, which may vary per individual. Also, we need to take into consideration if the athlete is doing too much or not enough of these activities or workouts, which can potentially delay the release of the egg. So this is if they're doing high intensity workouts. It can extend the menstrual cycle or even cause amenorrhea, amongst other things. But not enough exercise can also cause our symptoms to worsen. Symptoms such as cramps, mood swings, PMS, stuff like that. However, aerobic exercises such as cardio can help decrease cramps or lower the pain in the abdomen when menstruating. And anaerobic exercises can do the same, but primarily if done so within the first 2 weeks of menstruation. And it is safe and beneficial to exercise during your period. Purpose statement. So the purpose of this study was to determine the effects of aerobic training, such as cardio, which I previously mentioned, and anaerobic training, like lifting weights, on the menstrual cycle, focusing primarily in the female collegiate athletes between the ages of 18 through 22. I sort of went with this age group because by this age, females already know enough about their cycle. So how long it is, if it's light or heavy, what kind of symptoms they get, how long it lasts, and it would be easier to gather data. For my research question, it's as goes. What are the aerobic and anaerobic training effects on the menstrual cycle of collegiate female athletes ages 18 through 22? Methods proposed. For this study, I propose to use a quasi-experimental ex post facto design. So this would be incorporating a questionnaire and surveys. These questions would be based off of 3 phases of menstrual cycle, which I mentioned before, are the follicular, ovulatory, and luteal phases of the menstrual cycle. And it would be pertaining to physiological responses, their symptoms, and performance, before, during, and after. Technically, after wouldn't really be a big thing because once it ends, it's the menstrual cycle just starts over again. So some of these questions were yes or no questions, where most of these questions are yes or no. Like, was your menstruation regular? That would be a physiological response, yes or no. During menstruation, how did you feel before, during, or after menstruation? That will pertain to symptoms. And to performance, whether it decreased or increased before or during menstruation. For the study, there would be 25 participants separated into two groups. One group would be the anaerobic group and one group would be the aerobic group. These are an example, these are the table. This is a table, two tables that would be examples of the questions in the questionnaire. So the first table, as you can see up here, table 1, physiological response to exercise. Responses were primarily yes or no. The questions would be regular menstruation, yes or no, some sign of nervousness before menstruation, during menstruation. So here you can see during menstruation, a lot of people feel nervous to perform. During menstruation, if they felt lumbago, queasiness, headaches, or sickness. Period of menstruation, whether it was 4 days, 5 days, 6 days, or 7 days. Like I mentioned before, it could be less or it could be more. Table 2, exercise on premenstrual and menstrual symptoms. Responses pertain to light exercises or rigid exercises. Aerobic or anaerobic exercises can be split into these sections as well. Types of questions for here would be change in blood volume due to light and hard exercises. So light cardio might be a light exercise. Hard exercise might be like our anaerobic lifting weights, sprinting, stuff like that. And then the other second question would be pain before, during, and after menstruation, before cycle, yes or no, during cycle, yes or no, after cycle, yes or no. Again, after cycle might just be the beginning of the cycle again. Pain increases with light exercise or anaerobic exercise or rigid exercise. And here is the third table, which was pertaining to the personal performance during the menstrual cycle, whether performance increased or decreased, first 2 days, 3 and 4 days, or 5 and 6 days. Those are depending on how long the menstrual cycle was. Application. This study applies to our field primarily because of Title IX. Title IX is fairly new. I believe it's in 1961. It's in the 1900s, so it's not that old, but not that new either. With that being said, we now have more female athletes. Yet we have a lot of male coaches teaching or coaching these female athletes. So we should take into consideration that females do have different physiological differences as opposed to the male athletes. So we shouldn't be treating them exactly the same because of these differences, but we should be aware of the differences and know how to deal with the problems they might have or how they feel. We should be able to not just neglect the issue. I don't know, maybe a lot of you might have heard the phrase, it's a girl thing. Whenever somebody's not feeling well, they go with the phrase instead of saying, I have cramps or this or that. But I think it's very important that everyone is aware of it. We are dealing with females, we are dealing with males. We should be aware of their symptoms and how to coach these athletes. In conclusion, aerobic exercises such as cardio can decrease symptoms during menstruation, but an excess or lack of can cause problems, as well as with anaerobic exercises, except that these exercises should be done during the first 2 weeks of menstruation. Overall, exercise does have an impact on the menstrual cycle. We just need to be aware and pay more close attention to what types of exercises we're doing and when we're doing them with our female athletes. This concludes my presentation. Thank you.